Hey guys, good evening. Wanted to throw something at you real quick. This is an N95 respirator. Basically, it's a wearable HEPA mask. Okay, typically used for infectious diseases as pneumonia, things like that. Someone sneezes on you, particulates are captured inside the mask. The clip goes over your nose. Now, these are okay, all right, for the N95s. Crimping them down like this on your nose and getting a good seal around the sides is relatively difficult, and there's still going to be a breach in this part here, but it's better than nothing. And you can get the N99 and N100, which is what I prefer, in an emergency situation, ash environment, anything like that. The reason I'm throwing this out here is only just as a slight heads up for you guys, especially for you in the UK. Around, I think it was like 0921 UK time, they had found a hazmat situation with one person dead. I don't have the link for those details now, but I did notice it at 9:23 on today's date, the 13th of January 2017, in the UK. Over 23 hospitals were on what they call a black alert. Meaning the overcrowding. It's to the extent of they don't have any room, so they're even canceling cancer patient surgeries, diverting NICU and PICU units, and now they're even contemplating on flying in doctors from India, Pakistan, etc., even first and second year interns. So just a heads up, I don't know what's going on over there. Like I said earlier, the hazmat thing kind of caught my eye. And then 2 minutes after that, I noticed that there's 23 hospitals on black alert. Europe has been under an extreme amount of cold weather. But to see a pandemic type atmosphere from breathing problems, as it claimed in the website on RSOE feed, the emergency feed, I'm going to leave the link below. So check it out. So you're at least kind of got an idea of what I'm talking about. But it is something to pay attention to. A lot of people fly in and out of the United States to the UK. And to have 23 hospitals in 24 hours go on black alert to the point where they're at a crisis point to where patients are even sitting on units, or the ambulances, awaiting a place to be in. They can't guarantee the safety of patients, and I still have not seen anything that identifies the potential culprit, the bug, virus, or what might be occurring there. So no fear porn here, just saying, if you're in the UK, I'd minimize my contact outside with the locals. I'd actually minimize my contact with the air. I use a couple of different units here in my house to filter the air, and most of them stay by the outside doors. Small units do, and then I keep a larger unit to help clean the air. Most of them are ionic. I have a couple of ionic pros, which kill bacteria and viruses both. And then I have a couple of HEPA units that filter out down to point, I think, 0.03 microns, which is going to capture just about everything. There's a few viruses that would slip through that, but just a heads up. Okay, so those of you in UK, pay attention. All right, you got 23 hospitals on black alert in an area of that magnitude. There's something going on there. So heads up, I'll leave a description and link below. And I'll give you an update as soon as I hear something or read something else on this particular subject. But this is one I'm going to kind of follow and see if I can make contact with a source that I've got over in the UK, and see if I can get some real-time information for you. If you don't hear anything else out of me on it, that means I haven't heard anything. So anyway, just a heads up, be safe. In the US, same thing. Flu season is here. Okay, and it seems to have been here for the last 6 or 8 months. The stomach bug, commonly called the stomach flu, rotavirus, the adenovirus, rhinovirus. There's several other bugs out there that are causing havoc And also, I think in Nevada there was a lady who had contracted some type of an organism that was not not susceptible to any of the 23 main antibiotics that we use here in the United States. She was treated at the Nevada hospital. I do not know the hospital's name, but I'm sure you can find it on a search engine, Start Page or Google or Yahoo or whoever you use. But I do know that she did pass, so I'm keep her and family in your prayers. She was in India, and apparently she had contracted it over there. But I mean, the 23 antibiotics that come to my mind, even considering doxycycline, as unsafe as doxycycline is, Levaquin, ciprofloxacin, gosh, you know, which one could it possibly have been? MRSA is the most commonly known bacterial infection around here that is not treatable by most courses of antibiotics. Typically, if you got MRSA infection or a staph infection of the skin, they're going to put you on something like Bactrim and azithromycin, which is going to cover both spectrums in the antibiotic aspect of it, and they'll probably give you a topical cream that contains an antibiotic of some sort also. But be careful, overuse of those things. Guys, listen to me. Be mindful of the use of your steroids when you have breathing problems. They're going to put you on prednisone. If you got small kids, they'll put them on prednisolone, albuterol breathing inhalants. Make sure you clean those inhalers out. Make sure you clean your humidifiers or dehumidifiers out. Make sure you're constantly changing the HEPA filters in your home. Good hand washing techniques for your children and for you. Now, this is, like I said, this is basic information, but it's important. Some of these bugs that are coming out, because we're dishing out antibiotics like it's sweet tarts on Halloween, and that's not cool. Because these viruses will mutate and eventually become resistant to certain bacteria killing antibiotic agents that we're giving. So if you don't have to take the antibiotic, try to steer clear from it. Dose yourself up on garlic. Dose yourself up on things that are natural remedies. And you can search for a lot of them. Make sure they're safe for you. I'm not a doctor. I'm not here to give you medical advice. I'm just here to be kind of a guiding person to give you an idea of what we do. You know, and it seems to work. My son has a suppressed immune system, so we deal with it often and frequently. He was recently in the hospital for mycoplasmic pneumonia. You know, God's blessed us so far. We haven't had anybody else in the house that got it. I thought I was getting it, and I immediately started juicing up on, you know, probiotics, which we take pretty on a regular course here. But garlic, gosh, there's an apple cider vinegar, Bragg's, that, I mean, that stuff is priceless. Pure lemon, you know, apple cider vinegar. Of course, if you, like I said, if you're a diabetic or if you have high blood pressure, things like that, you need to check with your doctor on certain things, but I know most people aren't going to. And most doctors are not going to tell you, yeah, that's safe to do it, but you got to watch for this and this and this. Try to stay as natural as you can in treating some of these illnesses. The synthetic stuff is great if you're pushing on that edge of having to go to the hospital. But if you can let your body fight it by giving the body what it needs, like I said earlier in my other video, nascent iodine or potassium iodate in some type of a multivitamin, Protovite. I take Protovite. If you got a chance to look that up, fantastic product. I would tell you stories on top of stories of people that are taking that are friends of mine. Some of them are disabled vets. Some of them are nurse practitioners. Some of them are pharmacists. And they take Protovite. It's spelled Prodovite. That's Papa Romeo, Oscar, Delta, Oscar, Victor, India, Tango, Echo. Okay, Prodovite. Look it up. It is expensive. It's around $65 or $85 a bottle, but check it out. It's worth your time. Okay, so anyway, HEPA masks, pay attention. All right, link is below. Subscribe, like, and share if you don't care. I would appreciate it. And more to come later on. Have a good day, good night, and be safe. I'll see you out there.